Welcome back, everybody, to another episode of Rebellious Wellness Lifestyle. Today, we're actually going to talk about more of a lifestyle topic, I think of it as, maybe both, a wellness and a lifestyle topic. My guest is Dr. Rachel Degurse, and she's an expert in all things beauty. She is board certified, lives in Colorado Springs, and she says she's more than just about medicine. She wants us to look and feel as well as living our best, which is just in keeping. I've for years said we want to be healthy, that's one thing, but we want to look as good as we can for as long as we can. And I think obviously that changes as time goes on. What does that mean at 60, 70, 30, 40? They're all different, but we can have good skin and we can have healthy bones and healthy digest, all that stuff. So welcome, Dr. Rachel.
Thank you. I'm excited to be here.
So tell me a little bit about what made you zig into this area of medicine?
That's a good question. So my background is in family medicine. I'm a board certified family medicine physician and been was working in private practice for a little over 10 years, and my company that I worked for got purchased by a big corporation. And all of a sudden, my life took a dramatically different turn when you go from being in control of how you handle and manage patients to losing that. It makes you reevaluate how you want to provide patient care. And really, I lost a lot of the relationship that I enjoyed by having to cut down on my amount of time that I was spending with patients. I took a real deep look at how I wanted the rest of my career to look, and I decided to open up a med spa, which was initially just something to do on the side as a way to reconnect with people and connect with them in a different way. And eventually I just decided to make it my full-time job. And I've been doing it full-time now for a little over a year. I just passed my 1 year anniversary of leaving.
Congratulations.
Thank you very much. I'm very excited about it. And yeah, it's been a wonderful journey, but it's just a new way to look at healthcare and patient relationships. And I still got to do the things that I love the most, and that's really just taking care of people.
So I want to ask you, before we get into the meat of what you do, med spas are everywhere where I live. And I've read there doesn't have to be a doctor, there doesn't even have to be a nurse practitioner. What makes a good, reliable, safe med spa? If somebody were looking for one, what would you suggest they look for?
That is a fantastic question because you're right. Med spa world is like the Wild West. And I say that coming from Colorado. Every state is a little bit different on their regulations for med spas. So you can be in a part of the country where they have a lot of regulations. New Jersey actually has quite a bit of regulations around med spas. But where I'm at, there's very little. Basically, for most med spas, what you need is what's called a medical director, which is a physician that supervises the people who do work in the med spa. And the people that they supervise in some places need their own certifications, but in other places, they just need the medical director's okay that, yes, this person is qualified to perform this procedure. It's all related, is based solely on what that medical director's opinion is as far as the credentials and qualifications of that person. So what I would say is if you're looking for a reputable med spa, first, when you're checking out their website, there should be somewhere in their website where it tells you who is working there. If they don't say, how do you know about us or find out more about us, and there's not pictures of people there that look like they're actual people who work in that place, then you probably shouldn't go there because you have no idea who that person is going to be that takes care of you. It could be a different person every time. You don't know what their qualifications may or may not be. So I would say that you definitely want to know who it is that you're seeing. I personally, as a physician, feel like physician oversight is very important and that a physician should be on hand at all times because while cosmetic procedures are fairly low risk, they are not no risk. And having a physician available in case of problems is really important for patient safety. A medical director technically doesn't even need to be in the same state when they are supervising a med spa. I, in Colorado, legally could supervise a med spa in Alaska, and that would be totally okay. I can technically supervise them remotely. Now, if you were in Alaska and you had a complication from a procedure, am I going to be able to fly up and see you? Probably not.
Yeah.
So I feel personally like it's important to have a qualified physician on hand in case of issues and emergencies, but technically that is not the legal requirement for most states.
So I would probably look for a physician, a nurse practitioner, at least nurses that are trained and certified and stuff on the property, maybe even administering the lasers or the Botox or the whatever.
Absolutely. Yeah. So in my med spa, I do 100% of the procedures here. It doesn't matter if you get a facial or if you get a microneedling procedure or a laser, it's all done by me. And there's some very qualified nurse practitioners, RNs, injectors out there for sure. So I just think it's important to meet the person who's providing your treatment, get a feel of what their credentials are, what their experience level is. And if they do have a medical director, where are they at? Are they in the same state, just
Yeah.
in case?
Yeah. So this conversation, all of the offerings that you have at pearlskinbody.com, Pearl Skin Body, that's your practice. The website has the .com. It's like wellness from the inside and the outside, because you prescribe hormone replacement therapy. So that's going to help us internally. I believe that it probably helps our skin as well.
Yes,
And
absolutely.
yeah, I've been on hormones for a really long time. I was lucky enough to have a doc 20 years ago who got it. He was a functional medicine doc. He was minoring, I'm going to say, in endocrinology with that specificity. And I don't know what my skin would have looked like otherwise, but I have to think that it's doing pretty good. So
I
if
think you
somebody
look
were
good.
to,
Yeah.
thanks. If somebody were to come into your practice and say, I'm in perimenopause, my skin is terrible, but I just don't feel well. Would you do a comprehensive, I'm not saying everybody needs to look for this at their med spa, but since you offer all those things, is that a
Mhm.
comprehensive conversation you would have with somebody?
Yeah. So I personally sit down with all of my new guests and I book myself out for an hour for that consultation. And we talk about any of the concerns that you might have, whether it's energy levels or how your skin looks or wrinkles or weight, any of those things that are on your mind, I'm happy to talk about in that consultation time. And then we come up with a plan that you feel comfortable with. And I usually will discuss a myriad of options that we can do. We can do lab work here. We can just focus on one particular area and then explore another area later on. But I think it's important to look at the whole person and what all of their goals are. And a lot of them do interconnect. If somebody is going through perimenopause, then their hormone levels is going to impact their skin, is going to impact their hair, it's going to impact your weight control, your sleep. All of those things are all important. And I think it's important to look at how all of those impact your internal and external health. Yeah, I definitely take a more holistic, comprehensive approach to patients' concerns. And yeah, I just let them guide me with what their priorities are.
So I know that you offer injectables, and there's a doctor that I follow who is an expert in metabolic health. Super interesting and smart and credible. No, like baiting us to get us to open her stuff. But she pointed out an article recently that she said she took seriously that said that Botox and those kinds of injectables can cross the blood-brain barrier. And that's a possibility of a risk for us. Now, we're learning something new every day. I'm not saying it
Yeah.
literally was from a reputable science journal. So it's one study. I don't know whether you've heard, I guess I'm asking, have you heard of anything like that?
That's not a study that I'm familiar with, but you're right. We're learning new things all the time. And I will say that Botox has been used for decades now. Sometimes we don't find out things like this until something has been on the market for a long time. At this point, millions of people have been using Botox or similar neuromodulator products for all, not just wrinkles, but for treatment of migraines and cerebral palsy spasticity and all kinds of other things. I would not be surprised if that were an issue that we're just now starting to learn about it because of the number of people that are being exposed at this point in time. But I'll have to look that up and get a
Yeah.
little bit more
Yeah,
educated about it.
interesting. And the article went on to say that the age of people, like when people, young women, for instance, they're 14 and 15 and they want Botox. And cumulatively over decades, their risk is obviously going to be higher than somebody who didn't start. And then there's that whole face Botox thing where people's faces don't move. That's sounds like a level too high for me to go to.
Yeah, I definitely have some ethical concerns about treating a teenager with Botox, not just because of the exposure of long-term exposure to a product like that, but also what is that doing to their mental health and
Mm,
their identity and how they're viewing their body. So I think you just really have to be conscientious about those types of things in that particular demographic.
yeah. What is the most popular thing that a woman, let's just say a 50 plus woman comes in and says, my face, you got to help me? What's the most popular thing women are asking for these days?
So, probably sagging skin is
Mm.
what I get the biggest complaint about. So, as we get older, we tend to lose some volume in our mid face, like our cheekbone area. And then gravity kicks in and everything just starts migrating south. So, you get some jowling, heaviness in your lower face, maybe some like deep folds around your mouth. So, that's the most common complaint that I get. And hormone therapy is actually one of those things that can help that. Estrogen in particular is very important for suppleness of your skin. There are microneedling procedures that can really help with collagen repair to restore the elasticity of your skin. And then, of course, there's injectables. But in Colorado, a lot of the people here tend to want a more natural look. They're hesitant to do a lot of injectables. That's where it's nice where we can use things like hormone therapy and microneedling, just work with your body's like natural processes to make sure that your skin is looking good.
My regular dermatologist mentioned microneedling with radio frequency because
Mm-hmm.
it's deeper but it sounded like it was going to hurt. Tell me about that.
Yeah, so that's a procedure called Morpheus, which I actually
Okay.
do offer here in the office. It's a very popular procedure. So the benefits of microneedling are that basically you cause micro damage to the skin and it triggers your body to repair itself. And when it does that, it repairs collagen. But when you combine it with radio frequency, you also get a mild thermal injury, not enough to burn you, but enough to trigger a heat response. And that will also cause collagen to repair. But you can go deeper than traditional microneedling. You can go down to 5 millimeters on the face and neck, which is deep enough to puncture fat cells if you did have issue with fat pockets, particularly like under the chin area or in the jowls. So you can do some facial contouring that way. And then it's really effective for tightening the skin down to the muscle structure underneath because that heat will tighten that ligament that connects the two of them. So it offers a more robust response than microneedling alone.
And not quite as long a downtime as like a laser, say.
Usually we say 2 days of social downtime because you
Okay.
are going to be red and swollen. Typically with laser, you're going to be pretty red and swollen in that sort of same time period. But laser, you really have to be cautious with being out in the sun for about 2 weeks afterwards. Whereas with this procedure, after the 2 days, you can put sunscreen on, you can be
Oh,
out in public. You just might be a little bit more red and pink than normal. It is more uncomfortable than a laser procedure typically, unless you do like a resurfacing laser, and then that's uncomfortable as
yeah.
well. So definitely with the radio frequency microneedling, you want to make sure to have adequate pain control because that will affect results if you can't be as aggressive with the treatment because of pain. So making sure that you're going somewhere where they have a variety of options for pain control is probably a good idea.
That's a good to know. I had microneedling a couple of years ago and they put numbing cream on. But because I
Mm-hmm.
have absolutely nothing but like bony up here, like no fat,
Yeah.
After the first pass, I was fine, but the second pass, I just couldn't. So we just concentrated on the lower half of my face. But I didn't
Yeah.
offer anything else. So I don't know what other options there are.
Yeah, so here I do offer nitrous oxide,
Let's have a quick
so
one.
laughing gas basically. It is not a pain reliever, but it makes you not care that you're having pain. It relaxes you. And then I personally offer facial nerve block if necessary. So what your dentist would do, only it can do the entire middle of your face.
Well,
And if somebody is really sensitive to pain, I have very few people where this is necessary, but you can actually, I can prescribe like a one-time narcotic or like a Valium or something like that to just take the edge off. But those people definitely need a driver to bring them in, whereas the
yeah.
other options, you're good to drive 10 minutes after we finish the procedure. Yeah.
So I want to talk about fillers. I have been reading, who is it? Not Murad. Anyway, one of the big doctors who has those expensive medications that you put on your face after you've had a procedure. I can't remember her name. But
Yeah.
I heard an interview with her recently, and she said that some people don't actually process fillers and they get clumpy, and some people get a pillowy look. I don't know what pillowy look means, but so
Mhm.
not everybody should have fillers, and some people get too much of a filler. If you wanted a filler, like I wouldn't, I could get rid of these guys up here because they're just getting worse and worse. But I'm afraid of getting a filler, like putting something in my face. I know it doesn't stay there forever, but she said they've done surgery with people later on after, and the things are still in there, but they're not doing their job anymore.
Yeah. First, I'm going to touch on the area that you pointed out in particular. So that in between the eyebrows, that area is actually not an ideal location for filler because filler is specifically for volume loss.
Okay.
If you think about the name of it, it's literally filling up absence of volume.
Okay.
Whereas those wrinkles in between your eyes are usually from facial expression. So making that scowling look, that is what causes those wrinkles in between your eyes. And that is ideal for products like Botox because it will relax those muscles and prevent you from making that facial expression and causing that wrinkle. First and foremost, I just wanted to mention that.
Yeah,
But
no, I'm
filler,
glad you did.
yeah, but filler, there's variety of filler options out there, which can be really confusing for people. And some fillers are better in different locations of the face. And that can be really confusing. The reaction that you're talking about is a granulomatous reaction. So basically, the filler, even though it is a relatively natural product, it's made of hyaluronic acid typically, which is the same kind of ingredients that are like in our cartilage. That's usually what it is, but it can still create like an inflammatory response in the
Hmm.
skin, especially if it's injected in a layer of the skin that it's not intended for. And that can create almost like a little pocket of filler where your body is walled it off from the rest of your skin and it
Hmm.
just stays there forever. You can do injections in those areas to try to get rid of it or dissolve it. So there are ways to manage things like that, but ideally they don't happen at all. And so just making sure that you talk to your provider who's doing the injection and making sure what kind of filler are we using in this area? Is it the appropriate filler that we're using in the area because your lips and your chin or your cheeks are totally different? Should be using different fillers there. I would say really have a discussion about what your priority is and make sure you feel comfortable with the person who is providing the filler and what they do in case of those types of issues. You can get overfilled. So I always tell people it's easier to put more in than
Yeah.
take it out. So you can dissolve most fillers if you don't like them. Most fillers are reversible that way. But also, you can always just do a little bit of filler and then go back later and put more in. There's nothing wrong with that. There's some people who are saying, oh, you'll need 3 or 4 syringes to treat this area properly, which may be the case, but you don't have to do all 3 or 4 of them all at the same time. You could
Hmm.
do one of them and then go back in a couple of weeks and do a little bit more. That way, you make sure you're not getting an overfilled look.
Yeah.
So that's another option.
Yeah, and maybe the doctor thinks that a look would look good on you that you don't agree with. So if you went, let's just say I have a friend who had breast implants many years ago, And the doctor wanted her to have bigger ones. And she kept saying she wanted whatever size it was. And they put in the bigger ones and it was a problem.
Yeah, so see, I have a real big problem with that because
Yeah.
why are there, it's not their body. Like, you should really be listening to people and what their priority is. So that kind of bothers me that they did that.
Yeah. And in the end, she just thought, okay, this is fine. This is cool in a way. I didn't expect it. Yeah. I'm just
Well, I'm,
imagining that some doctor might think, oh, wouldn't it be great if you had none of these lines and and then suddenly you've got a face that doesn't look like yours anymore.
mhm. Yeah, that's a real big issue. I think people ultimately want to look in the mirror and feel like they still look like themselves. They just look like a really great version of themselves. Just finding somebody that you're on the same page with and is very clear about what your priorities is and will listen to you, I think is good.
Yeah, and I think when every doctor has before and afters, I've been to a lot like, oh, I want to get this done and that done. And I look at them, and if they don't have a picture of somebody that is my age, like I don't want to see a 30-year-old before and after of Botox. I want to see a 65-year-old of Botox or of filler, or because it's easier, correct me if I'm wrong, to make a young person look good with a little bit of work than it is to take somebody who hasn't had any and is 65.
You're not wrong. They have less sun damage to their skin, less environmental damage. They've got probably good hormones. There's some 30-year-olds out there that maybe need
Yeah.
some help there. But you're right. When you start with a younger foundation, then it's easier to build on that versus a foundation that's maybe needs a little bit of a little extra care.
Hmm. So speaking of injectables, I know that you offer pellets of testosterone.
Yes.
And I'm just curious about that. I was offered them a number of years ago. I was still on the fence about testosterone since I've crossed over, but I'm doing a cream because I just didn't like the idea of getting a minor surgery every however many months it lasts. But tell me why you like them and what the benefits are.
Sure. First, the benefits of testosterone for women are well studied, very safe. They actually started being used back in the 1920s.
Really?
Yeah, so a long time
Huh.
ago. And there's really good safety data out there about testosterone in women. I get the question a lot about, I didn't think women needed testosterone. It's not true. When you're in your 20s, you have plenty of testosterone in your body. That's usually what motivates women to have children because it's very important for libido and metabolism. It's important for maintaining muscle mass and bone mass. So it has a lot of really great benefits for women. So don't be nervous about doing testosterone for if you're a woman and you're feeling some of those symptoms. I prefer the pellets because most women are really busy, with their lives. They're juggling home and work and maybe podcasts, all kinds of things. So we're very busy. And so the less that you have to think about one more thing, then a lot of my guests find that to be a benefit. But certainly you can do a cream for testosterone, or you can do a sublingual tablet for testosterone for women too. The testosterone sublingually, you take it every day and the cream you usually apply typically daily. The cream, you do have to be a little bit cautious about where you apply it because you will or can trigger hair growth in the area that you apply it to. And then there can also be an absorption issue with it. So you don't want to place it on the back of your arm, for example, because it's not going to absorb very well. That
Yeah.
skin is thicker. And then also you have to worry about transfer to other people. So if you're in a home with young children, it's probably not a great solution for you because
Mhm.
you do run the risk of transferring that to a child. And certainly, if they haven't gone through puberty yet, you could create a hormonal issue for them. So you just have to be cognizant of some of those factors. But usually I'm doing the pellets in people, but I do offer other options as well. You mentioned minor surgery, but it's actually like pretty minimally invasive. You numb up the area and you do a really small incision and you insert them right underneath the skin. So it's like a tiny little scar that you might have, and you place those every 4 months. So usually you don't really have to think about it except maybe 3 times a year. So it's a convenience factor as well.
Oh, that's good to know. Good to know. And you mentioned the back of your arms. What about the back of your hands? What can we do for our hands with our age spots? Is there anything?
Yes. So age spots in particular are going to respond very well to a laser. So IPL treatment is great for those. But if you're concerned about the crepey look of your skin, a microneedling procedure is actually a very nice treatment for the back of your hands to help restore collagen in those areas. And you actually can do filler in your back of your hands too
Hmm.
to make them look more supple.
Less bony?
Yeah, less bony. So you can do that. So there's a few things that you can do to rejuvenate the look of your hands because that's definitely an area that can show people's age.
Oh my gosh, it's the worst. And I don't ever remember anybody ever saying, don't forget to put the sunscreen on your hands. I lived in California. I always put it on my face. I never thought of if I went out, I would slather myself if I was going
Yeah,
to the beach or riding my bike. But just on an everyday thing and my arms on the window or the sun, I wish I had, but I did not.
absolutely. The chest is also a really common area that
Hmm.
people will miss. Sometimes you do face and neck, but then you look at some people's chest and it definitely shows quite a bit of sun damage. So same kind of similar treatments, although we don't do filler in the chest area, but you can do laser or microneedling on that area to
Hmm.
rejuvenate.
Bang for your buck. What is your recommendation for, let's just say, I'm not getting a facelift anytime soon, but I would love to get rid of this and these. My skin, it's crosshatch, it is what it is. But overall, what would be the most rejuvenating thing for my type of skin without
Yeah.
going for under the knife?
So that radio frequency microneedling procedure is my go-to for somebody who wants to rejuvenate their skin and has, several things that they're concerned about: skin texture, fine lines and wrinkles, and maybe a little bit of loose skin. I do that often on people. So that's going to give you the most bang for your buck because we consider that to roll back the clock about 10 years off of
Wow.
your face, and then you age from there. So you can do a lot with a good skincare routine. You should absolutely be using sunscreen every day. And then a retinol is a great way to keep your skin looking healthy too. So doing those two things can really do a lot to slow down the aging process of your skin. But if you wanted to do a lot with within a short period of time without having to have surgery, then I would do that radio frequency microneedling procedure, or Morpheus is the other name for
And
it.
Morpheus is the same, basically just a brand
Yes,
name of that
it's
treatment.
just the brand name.
Yeah.
Yeah.
So what haven't we talked about that you want people to know?
Oh boy, there's so many things to talk about. But I think the most important thing for anybody who's concerned about their internal health or external health or both is to find somebody that's going to listen to you and be able to
Mm.
spend the time with you. Nobody should have to feel like a number. So if you're not getting the answers that you feel like you deserve, then meet with somebody else. There's
Yeah.
nothing wrong with that. Shop around, talk to a lot of people. Even if you see your doctor about your hormones and they say, oh no, that's normal for getting older, you don't have to accept that as an answer. You can go talk to somebody else. So I think a lot of times we get into this pattern of just assuming that what somebody's medical provider tells them is like always what they have to accept, but
Mm.
you don't have to do that. You can go and seek out other answers and talk to other people about how you're feeling.
Yeah, I agree. That's a great point. One thing that just I reminded myself of, retinol, retinoids, retinaldehyde. What is the difference and what should we be using to get as a daily routine or 3 or 4 times a week? One of those things?
Yeah, retinol or retinoid, those are vitamin A derivatives, and there's a spectrum of intensity of those. Those are all like in the same family. So retinol, retinoid, tretinoin, Accutane, those are all in the same family of vitamin A derivatives. They do the same sort of function for your skin by promoting skin cell turnover, but you can go from a very mild version of that, like a retinoid or an over-the-counter retinol, to a very strong, potent version of that, which the most extreme would be Accutane. Pretty much for most people, the retinol is going to be sufficient for promoting that skin cell turnover and keeping your skin looking good. And I have a bias for medical grade skincare because the quality of the ingredient is going to be better, and you're not going to get any of the junk in there like fragrances or parabens or the things that you really should try to avoid exposing yourself to for a variety of reasons. But if that's all you can afford, then that's going to be sufficient for most people, is an over-the-counter retinol. But if you have a more extreme skin condition like severe cystic acne or acne that's not responsive to most over-the-counter treatments, then like a tretinoin or Accutane is going to be a better choice for you, but you really do need to see a medical professional for those. But for the most part, most people should be okay with a daily retinol, building up to a daily retinol, I should say. You should start off with probably once a week because it can still be irritating to the skin, and then building up based on tolerance.
And be really careful what else you put on your skin, because it can, if speaking from experience here, when I use it and then I had to change sunscreens because the sunscreen would tingle and it wasn't burning exactly. It just wasn't comfortable. I don't know what the ingredient was that wasn't working, but anyway, I switched to something totally bland and still gives me coverage.
Sounds like you're having an interaction.
Yeah. But also we have to, especially when you're using those cell turnover things, always have to use the sunscreen. If you're not using it already, you have to be careful because you can easily get burned-ish. It looks like a burn. It feels like a burn.
Yeah, absolutely. Yeah. Absolutely. Very true.
If you are in the area of Colorado Springs, I guess it is, and you want to go see Dr. Rachel, you can find her at pearlskinbody.com. You can book an appointment there. She has before and afters. She lists what treatments. Her phone number's there. You can call her. And she has a couple of memberships, which I think is really cool, where you join for whatever level you want to join, and you get benefits. You get discounts on things. You get a treatment every month. And I like that idea. I wish we had one locally. So where exactly are you? If somebody is familiar with that area, where are you?
If you're in Colorado Springs, I'm located near I-25 in Woodman.
Okay.
Which is pretty central.
Okay. Perfect. Thank you so much for your time and your expertise. I learned so much, and I'm going to have to go find myself some Morpheus.
Thank you.
I have a birthday coming up, so it'll be a birthday present.
Oh, happy birthday.
Thanks. People, I'll be back next week with another fabulous guest. Be well till then.